Tag TV and Tag Radio be seen and heard by both technology users and technology producers throughout the state of Georgia and around the world. Low cost, big benefits, powerhouse online branded video and audio has arrived. Tag TV, Tag Radio, there's a lot more to know. This edition of Tech Talk is brought to you by Globalspeak.com, new media consultants, corporate video and audio communications, video and audio production and distribution, live and virtual event production. Tag TV and Tag Radio is a service of Globalspeak.com, creatively delivering powerful marketing, video, and audio solutions. Sure, it's simple. Improve patient health care by providing innovative technologies, solutions, and services to the healthcare community. But wait a minute. What about new government requirements for electronic medical records, EMR, and HIPAA compliance already affecting both physicians and hospitals? What about financial management of medical billings, the financial health of these crucial health service providers tasked with their own financial well-being while providing the best possible care to their patients? Then there's the challenge to stay informed and educated on the most up-to-date information on implementing the right EMR, use criteria, economic stimulus packages, and government reimbursements. Greetings, everyone. It's Thursday, November 3rd, 2011, and this is Tech Talk with Technology Association of Georgia President Tino Mantella. I'm your guest host, Frank Baia. Enter the era of robo-doctor and advanced, highly computer-driven medical devices, and even more advanced hospitals with everything from robotic prescription dispensers to microcomputer advanced near non-invasive surgery, and quite frankly, beyond. Once all a practitioner really needed was a bedside manner, more like the beloved family member. Today, physicians face the challenge of disruptive technological change. They can be overwhelmed or, in fact, be allowed more time to focus on what they really do best, provide the best possible care to their patients. Up to the Tech Talk, cloud-based electronic health records, practice management technology, and technologically advanced physician and hospital revenue cycle management products that provide tomorrow's infrastructure for health services today. We Tech Talk advancements in health solutions that will unify the medical and financial aspects of today's healthcare providers with Baha Zeidan, co-founder and CEO of Azalea Health Innovations. Baha has extensive experience leading IT support teams and spearheading projects. His knowledge in healthcare information technology includes design interface for medical laboratory systems with a wide range of physician electronic medical records and practice management systems. A Gold Award graduate of the Decade winner in 2008 from Valdosta State University, and a Chamber of Commerce Valdosta board member, as well as a HIT advisor for Wiregrass Technical College. Health innovation is the Tech Talk focus as we speak with Baha Zeidan, co-founder and CEO of Azalea Health Innovations. Baha, welcome to Tech Talk.
Hello, Frank. Thank you. Look forward to being on your show.
A lot of conversation going on about independent technology companies and the role they're going to play in the healthcare technology field. Our listening audience is pretty much a generic group of technologists, both sides from a management standpoint and from the actual programming and IT standpoint. Maybe share with us your perspective in terms of how, in this whole healthcare industry, healthcare technology field, independent companies are going to operate. What role are they going to play?
Well, thanks again, Frank. You raised a very important question because right now the government is pushing very hard for the digitalization of the healthcare industry.
Mm-hmm.
And it's very important for smaller companies, especially in the technology space, to have a very good intuitive products. And actually, CNN Money pointed out that the natural cycle of the tech industry favors agile startups. And that's what Azalea Health Innovations about. Is we're a Georgia company that we embrace the cloud development, and that's the future of the healthcare. The government was very smart by pushing mandates to help speed up the process of adoption of electronic health records by physicians. and that overall is very helpful to the economy, to the small startups, and to the advancement of technology overall.
A lot of dynamics in play. I know in the private sector, when you're not dealing B2C but B2B, there's even the problem of cultural adoption, where you can come up with a grand technology advancement, but will people embrace it? How do you feel in terms of the overall interaction of introducing these new technologies, even though they're advanced and efficient and money-saving, and I would guess obviously more practical and crucially important to healthcare, but are you feeling that the organizations that you're dealing with are embracing it and willing to adopt these new technologies into their culture?
This is a good question because in the healthcare traditionally, as you know, Frank, it's been all for centuries actually on paper. And the physicians until now they're most likely to use paper over using digital information. However, this culture is changing and shifting slowly. One, by there's a lot of intuitive tools now that is web-based. That's very simple for the physician to bring a piece of technology like the iPad and be able to document his encounter with his patients just as comfortably as writing on a piece of paper. So the technology between the devices as well as the user interface with the new software makes it a lot easier for physicians to adopt those new technologies. And yes, the physicians traditionally been resistant in general to moving to electronic formats rather than paper just because of the simplicity. However, with data sharing and how much we can share by digitalizing that information, it could save lives and it will improve the healthcare in general, since the more information the physician would know about a patient, the better, and digital technology can make that much more convenient rather than paper charts. So it's a tough road, but culturally, the culture has been changing slowly since 2004 and 2005, and especially after the ARRA and the push by President Obama for meaningful use systems. It's definitely moving toward that, and physicians basically now have no option but
I was just going to say, it's mandated, right? Isn't there a fixed deadline?
Absolutely, yeah. It's mandated. Now, the government between now and 2014 given incentives for the physicians to adopt electronic health records. They're giving them about $44,000. However, after 2014, they will start penalizing those physicians who do not adopt electronic health records.
So on one side, they have an incentive of up to $44,000 to act now before the deadline, and then actually have a consequence if they don't, beyond the penalty, actually losing some of those resources and actually being penalized for not doing it.
Absolutely, absolutely. And actually, the government and the patients themselves become more educated, and you will see later on in our future that the patients themselves rather go to a physician that can provide their electronic health record electronically, where they can go online and be able to look at their problem list, look at their medication lists, and be able to educate themselves about that information and share it with their family if they need to, versus going to a physician that is still using paper. So the patient's eventually going to help move this culture to the electronic world.
Now, you talked about the cloud. Certainly, there isn't hardly, I don't think, a sector within our industry that isn't being impacted by digital technology, and certainly by the applications and the dynamics, I guess, for lack of a better word, that are presented by the cloud. Do you follow a specific development philosophy, and maybe go into how you feel as far as your company having an edge in the healthcare technology field?
Well, it's a very hot topic, as you know, Frank. But mainly, the cloud provides a platform that allows companies to scale up and down as needed, and the cloud brings affordability to access of data, and at the same time, the companies, they're responsible to be able to secure that data on the cloud. Our philosophy with Azalea Health Innovations is agile type of development. We do like to meet the government mandates, so our electronic health record, Azalea EHR, is certified by the ONC. However, we also listen to our clients and our physicians and our clients. Once they have a good idea and a good way of doing certain things, we like to listen and basically implement it in an agile way and push it live where they can see it immediately, not rather than wait for the next service pack or the next version and wait to update the server and so forth and so forth. We handle all of the backup, all of the hard work that goes into an implementation in the back end, where the physician, all they need is a browser, and any browser, if it's Safari or Firefox or Internet Explorer, and be able to access their patient data. They'd be able to access their electronic health records in their office, and be able to message their patients and their staff.
You mentioned, I guess what I'm going to call patient-mandated care or patient-managed care, where the actual patient does more and more to manage its own health care. Is there an actual professional term for that?
Well, there are probably multiple. Personal health records, PHRs, is the term that used in our industry for patients to be able to go online and access their health records. And I'm sure there's a few, patient portals. And
I constantly say that terminology doesn't keep up with the evolution of technology, depending on what field you wander around with networks, channels, those kind of things, and everybody's got a different meaning, new media, But where I was going with that is that one of the things that I think a lot of people are talking about in the human resource arena is the idea of talent as a brand, the idea that in the future, what we perceive to be employment is still going to be around, but what is more important going to evolve is how individuals, academic, in the case of, say, a professor, in this case a doctor or a health specialist, will actually become more and more critically important as an individual, providing their particular kind of capability in a special way simply because of their individual uniqueness. Do you see the evolution of a...
Absolutely.
Okay.
You hit that. Absolutely. You're right on the right direction, and actually the government feels the same way with the push of electronic health record. Basically, the more educated the patient is, the easier that you could treat that patient. We have, of course, a problem of obesity in the South and in the nation in general. And the more educated people know what's the danger of that and know what to do to manage those conditions, the smarter our population will be. So smarter patients are much more, they save the system a lot more dollars too. Smarter patients can take care of themselves, they can eat healthy, they can understand their medication, they can read about their medication. It's part of the meaningful use. One of the points that physicians have to meet meaningful use is to be able to provide the patients with patient education material. And that's very important because an educated patient will cost the system less, and they will be able to take care of themselves better than coming to the emergency room because they ate something wrong. And rather they can go online and read about what their condition and what's the best things for them they should eat, and versus what the worst things that they should not eat. And so it's definitely an educated consumer, an educated patient is an asset to the country in general.
Well, we've touched upon a lot, I think, in terms of the immediacy of electronic records and some of the evolution of the digital impact into the marketplace. We've kind of a little bit into the healthcare technology of the future. I guess really to go any further at this point would be highly speculative at best, because I think we talk about things growing exponentially. I think in healthcare it's almost phantasmagoric. It has some kind of chemical, magical aspect to it. Just seems to leapfrog into the future. But what about, and this is drifting a little away from your specialization, Baha, but just out of curiosity, things like futuristic thoughts, like from Kurzweil, the futurist, who talks about biotechnology and and the kind of in fact, he talks about a synergy of man and machine, that kind of thing. Is this the beginning, the forerunner of that kind of thing, as we go cloud, as we go digital, as all of the healthcare records become electronic and we get more educated? Is it a point where this is how we learn to live longer and become the future, science fiction things that we often see in movies?
Yeah, absolutely. And actually, unfortunately, the healthcare information technology piece has been a little bit behind the financial information technology. The financial sector has been investing heavily in information technology. You look at banks and the financial institutions; they were putting a lot of money. The healthcare, we just recently started doing that. But if just looking at the healthcare information technology, I see us in the future being able to grab all of our past health record, just like we do with Social Security and getting your credit score online.
Mm-hmm.
And as a consumer, you will see your credit score, and you can try to work how you can improve that. I'm not going to say the healthcare they're going to score every patient. However, the sharing of data and being able to make sense of this data and be able to have the consumer educate themselves and work toward certain goals to help themselves live longer, live healthier, that is the future of the healthcare, and I think that's going to be accomplished with the digitalization of healthcare, and it's going to be the accessibility to that data is very simple in the future. It's just like now you get your credit report by putting your Social Security and you agree, and they pull all your credit, all your addresses that you've ever lived in, all of that information. And I think that's going to be possible in the future. And since healthcare is a global issue, it's going to be possible for every consumer, the 7 billion people who live on Earth, be able to have access and share this information, because wherever there is a problem in the world, we should be able to react and see how we can fix our humankind, and information technology can provide us with that information and help us help one another.
In the next coming couple of weeks, the state of Georgia is going to once again have a health IT leadership conference. Last year it was a home run, out of the ballpark hit. I think a lot of people gained together just out of curiosity and began to look around and begin to realize that, wow, we have an industry here. That's evolved now into a situation where, through the Technology Association in the state of Georgia, we've identified health IT as an area where Georgia leads as what they now call a cluster industry for our own potential economic growth and leadership. A lot of exciting things. I know certainly Azalea is at the leading edge of what's going on in that particular vertical, and I can just say that, unfortunately, and I often say this, that the really good interviews go too fast, and unfortunately we're out of time. But, Baha, thank you so much for taking time to visit with us on Tech Talk today.
Thank you very much for having me in your program, and I look forward to the future, and I really appreciate your interview.